Hello everyone. My name is Kim Boon. Today, the topic for our seminar is Migrants and Threats to Healthcare in Malaysia. I will discuss about the solutions to resolve the issues. Several current emerging threats and risks exposing public health vulnerabilities are linked to global processes, such as economics, trade, transportation, environment and climate change, and civil security. Many of these processes are influenced or affected by the migration and mobility of human populations. International migration, which is a supporting component and a consequence of globalization, increasingly affects health in migrant source, transit, and recipient nations. The flow of populations between locations with widely different health determinants and outcomes creates situations in which locally defined public health threats and risks assume international or global relevance. In February 2016, The Star Online reported Health Minister Datuk Seri Dr. Subramaniam's statement that Malaysia will not be providing free healthcare services to foreign workers in the country because doing so will make the healthcare system collapse. He said that if you're here and ill, you have to pay for it. We are not saying you cannot come to hospitals, but you must pay the costs. If not, our system will crumble. The statement was made after Subramaniam's tour of the World Health Organization's Global Service Center in Kuala Lumpur. Subramaniam added that the responsibility of ensuring that foreign workers get necessary medical care is normally shouldered by their employers, who provide them with health insurance. However, health insurance is not likely to be available to workers who enter the country through non-working visas, like foreign students who work part-time to support themselves. The solutions suggested to resolve the issues included accessibility, availability, acceptability, qualities, health insurance coverage, monitoring migrant health, policy and legal framework for migrants. I will focus on accessibility and availability of healthcare system. Legal status is one of the most important determinants of the access of migrants to health services in a country. Each migrant should have full, uninterrupted access to a hospitable environment and, when needed, to high-quality health care, without discrimination on the basis of gender, age, religion, nationality or race. WHO supports policies to provide health care services irrespective of migrants' legal status. As rapid access to health care can result in cure, it can avoid the spread of diseases. It is therefore in the interests of both migrants and the receiving country to ensure that the resident population is not unnecessarily exposed to the importation of infectious agents. Likewise, diagnosis and treatment of non-communicable diseases such as diabetes and hypertension can prevent these conditions from worsening and becoming life-threatening. In some cases, significant improvements in access to health care could be achieved through the reduction of bureaucratic hurdles in obtaining documents. In particular, hurdles for obtaining residence and work permits, identification documents and health insurance papers should be reduced. Improving access to health care for older migrants and elderly migrant women. Access to health care for these two special groups is often limited due to the existence of multiple barriers, which might include the lack of pension years, high unemployment risk, care responsibilities for other family members and social isolation. These problems should be addressed by appropriate policy interventions, which also need to take into account cultural preferences, for instance those related to long-term care arrangements. At the same time, information about the overall situation of these groups is currently lacking. Therefore, more resources should be directed at collecting statistics and improving the knowledge about the situation of older migrants. Apart from that, more responsive services should be provided as well. Part of the solution to reduce barriers of access to health care for migrants will involve increasing the level of supply-side responsiveness. Healthcare providers should strive to take into account the specific characteristics of the healthcare demand among migrants and to provide more responsive services. This may include increasing awareness about services available, providing translation or interpretation services, promoting culturally friendly services and combating discrimination. These are my references. That is all for my presentation. Thank you.